Massage therapists were interested in me because it was kind of like a mechanic who didn't want to teach people how to change their oil, because if they knew how to change their oil, they wouldn't come and get oil changes.
But that's not true.
And I'm like, no, if you teach them how to change their oil, they're going to realize that it's a complicated process and they're busy and you're going to give you $30. I mean, you gave them some education, but I think that's how massage is. Like, people don't massage each other because they're lazy, not because they don't like massage. Yeah. Do you want more like the right side, left side? I'll do a little bit of both. Okay, I'll do a little bit of both. So I'm going to do just like a simple one first. Just going to have like ankle, knee, hip, and shoulder kind of in one line. I'm going to bring you over. And then this is kind of a gentle one for like beginners, just to see, because you'll probably want something more robust than this, but I want to see how you respond. How's that?
That feels good.
Okay. And that's just a tester, right? But then, in your case, if I isolate over here, how's this?
That feels good.
Is it too sharp anywhere? Like, in other words, not on your spine, nothing's...
It's not too sharp. Is my ankle supposed to be hooked over the other leg or on top?
Yeah. How's that? Now, if I isolated the shoulder, even more, right?
Okay, that's a little too much.
There we go. Better there.
It's too much on the shoulder. I could take less weight on. Yeah.
Or I can take that off completely.
Yeah, that's probably good.
Okay, and in your case, because I've already done this, you don't want pressure on the shoulder. My first thought immediately is to leave you there, come out here, and press your sacrum that way.
Yeah, that's lovely.
Yeah. But now it's a twist, and I can use the other foot to like work along your spine. Because now there's this isolation here.
I can take more attention.
Right there?
Oh, that's amazing.
Okay, I'm going to turn my foot to the side, see if I can hook around your shoulder blade. How's that?
Yeah.
Not too much?
Oh, that feels
And it's not too much where I'm holding at the forearm?
That feels good.
Yeah.
Wow.
Not too much?
No.
Can you move away from the camera?
Oh, I'm fine.
Oh, you're fine. Just a second.
Wow.
Okay, now I'm going to take that out and just twist you again. But lots of movement, right? Mm-hmm. Okay. Then if I would unwind you, then I could just repeat to the other side. The other option is I could do like a straight-legged version. The straight-legged version is going to give you a little bit more. Like if I isolate here at your thigh.
Mm-hmm. That feels really good.
How's that?
Oh, yeah.
There we go. And then there's also kind of IT bands, too much on your leg,
no,
foot, or
that feels
anything.
nice.
There we go. And if I decide to make it more of a twist, this is where I could reach over. How's that? How's this through your rib cage?
Everything feels good. I'm not in love with the shoulder as much, but everything else is very nice.
But you liked when I took the shoulder and pushed into your rib cage.
Stabbed under it, yeah.
Stabbed under it. Stabbed directly under their rib cage.
But I had, the one Thai massage I had, he slid his hand underneath my scapula and lifted me off the floor.
Yeah.
I was just hanging like a chicken underneath that.
Yeah. He chicken winged you.
He chicken winged me, yeah.
Now, the other option is like I'm isolating this thigh.
Mm-hmm.
I could drop down and then use my feet to work on this quad.
Oh, yeah, that's so good.
So how's that?
It's IT and that. Oh, that is that is quite lovely.
How's that?
Oh, yeah, that feels good.
Toes.
Oh, so nice.
Wow.
Because just multiple points of contact. Like once you start playing and communicating with the person, it's pretty interactive. I think it's just fun. I would always prefer doing mat based as opposed to the table. I just felt like there were more options. How's your calf?
That feels really good.
How long is your average massage session? Like the most often you do this length?
3 hours. So on my menu of services, I talk to therapists about this constantly, about branding. Mm-hmm. We were working towards the trademark of a new name. That trademark was declined. We had to go back to the drawing board, pick a new name. There are only 2 things on my menu of services. Okay. A reboot that's 3 hours, and a belly reboot, which is abdominal work for 90 minutes.
You do just abs for 90 minutes. Those are only 2 hours. Okay. Wow.
And what does the belly reboot do?
It's a good question. It's a thing I learned last, and the class I took was on Chinasong. And guess what happens? You take a white guy from South Louisiana, and you teach him Thai massage, and then he starts unfurling Thai theory, looking at pain science. And then I take a class with a guy, and now he's talking about chi and organs and whatever, and also like not just organs in a Western context, but organs in a Chinese medical context. And I go, what about science? What about nerves? What about the vagus nerve? What about?
But all of that is in the meridians. The vagus is in the
Okay.
same.
And I'll never argue with you about that. What I'm saying is I like science because it gives so we know you got a small intestine. That's all I'm saying.
Right.
So as I kept looking at it, I keep doing the abdominal work. So women would come in and they'd say, I have severe menstrual cramps. Now, I've never had a menstrual cramp.
This is good.
I would work on them, do abdominal work on their belly. They'd call me a week later and just freak out.
No.
They're like, I've never had a cycle like that. What did you do? Like it normally feels like velociraptors are trying to chew their way out of my body. It was like the easiest cycle I've ever had. And I go, oh, are they having like some sort of smooth muscle issue?
Yeah.
Like, is their uterus like not, a woman, she had chronic constipation. I worked on her and added the belly work into the full session, like 45 minutes. Now here's the thing. I uncovered her belly, used a little coconut oil, and just slowly like opened all this up. I didn't really feel anything tight or dense or restricted. I just worked within her comfort level. She had chronic, like probably bowel obstruction, like constipation. She told me a week or two later she felt like she had the flu, like 3 days after the
Because
session.
you got toxins out.
She had massive diarrhea for like 3 days. And then she said, Robert, my digestion returned to normal for the first time in like 10 years. Like after that one session.
How many of those secrets are you going to share with us today?
It's not a secret, it's just abdominal work.
I'm ready. We're ready.
Do you have problems with your low back or?
I don't, but does someone else want to do it? I feel like a hog. Who wants to let him get on the belly?
No, your stomach
Sarah,
is cute.
you
Come on,
haven't
let's
done
go.
it. You want to do
Sarah,
it?
Stephanie.
Stephanie. Oh, I'm sorry. Do you want to come and do it instead of me? Sure. Yay!
Yeah, that's fine. Do you have any problems with the digestion or anything?
Low back.
Low back? So when your low back bothers you, how does it bother
It's
you?
really tight.
Just always like along the sacrum? So does it always feel like a band across the sacrum? Okay. So when she tells me it feels like a band across the sacrum, my first thought is that potentially it could be her psoas. But when I say that, here's the weird thing, and this is what I was saying about Walt Fritz and like pain science. When I press into your abdomen, do I feel your psoas?
Yes, you can. Yes. No?
She's making a face over there. I knew. See, I knew. She. I look over and she's like, man, he's digging. He knows what he's.
Too deep to access.
From there,
Except for one tiny little point, which I argue with others on, but
can you stab up into the iliac crest, bend the knee, and take it really deep down and then touch it?
So lay back on your back for me. Do you have more issues on the right or left side?
It's pretty even across.
Pretty even.
I know that my
junction
hip
of
flexors are tight.
Okay, so I'm going to start on this side.
where the
Tightest.
psoas and the iliac form.
You don't have a belly button ring there, do you?
I do.
Okay, I was just making sure. No, I could just feel the texture difference, and I was making sure I didn't want to press on like any. Yeah.
My acupuncturist made me take that.
Parallel. Okay.
Said it was, yeah, he said it was blocking my meridian, the chi.
How long ago was that?
Month ago?
It's
Did it close?
I don't know.
not, I can
It's
show,
old. I'm old.
but no.
But normally you use coconut oil.
So usually what I would do, the thing is, like, the reason this session's 90 minutes is because I really take my time softening all of this area before I start applying any kind of pressure. But in her case, I had the chance to hang out with her earlier. You know, we had a little bit more of a rapport and conversation. Like, diving into people's bellies is not something that is very normal in like Western cultural context. How's that right there?
Okay.
Yeah. Now, is it better if I slide just a little bit up or a little bit down?
Up.
A little bit up? Okay.
So is this, what are you pressing on?
And then if that's a good question. And if I slide just a little bit over towards the midline, is that better?
Yeah.
Okay. Right in there. So this part of the work is the most confusing to me, and I've got students asking me to teach it. I'm going to have to quickly get some books by like Mantak Chia and people who teach Chinasang, and then look at what they're saying, draw what I can out of it, and then basically have Diane Jacobs call me an idiot again and like ask her what the hell's going on through people's abdomen because I can't figure it out. A young lady came in to me. She was maybe 29, 30. She had back pain. She had that bar across her sacrum. It was hurting her. I did all the standard Thai massage stuff. Worked on his gluteals, worked on her hips, mobilized her, didn't touch her back pain. And I'm like, it's her psoas. And I went into her abdomen, much like I'm doing to you, and it was like you could feel what felt like a band on one side of her spine. Like if you look at an anatomy chart, you can see the psoas on either side. It felt like a band on one side. And I was like, oh, right, you know, like for in your case, it's more up, right? And then over? Okay. And I would hit that and I'd go, ooh, right there. And she's like, oh.
Is that it?
And I'd say,
It's right there.
Yep.
does that feel like your back pain?
Yes.
In your case right now it does? Because I was telling a story, but yes.
Right, no, I get it.
And here's the thing. It feels like what you were saying, right? The challenge is they're saying that it's not actually the psoas, that it's so deep you can't actually feel it. I know that I feel some tension and density. Here was the problem. When I studied abdominal work and they called it Chinasang, I thought when I walked into the class that we were going to be spending time working on skeletal muscle. But what it feels like is happening is you're actually taking your time and softening rectus abdominis, softening the obliques, so you can reach down and start having an effect on smooth muscle tissue, which is your digestive tract, which is large intestine, small intestine. Like when you go through, like we don't have conscious control over those organs. It's a different part of our nervous system. So it's very confusing to me because I don't know if, for instance, I often use trigger point reference charts in class to be able to explain to students, like, person has a problem in their knee. And I'm like, where? And they're like, right behind their kneecap. And I'm like, you need to check their rectus femoris. Probably up at the top. There's a trigger point up here. But then I don't really teach trigger point work because I don't think the science really holds up as to why it works. But it works. See what I mean? And I keep doing that again and again. Now, if I give you more pressure, do you want more medial?
Yes.
Right there.
Basically, you're softening the muscle to get down to the organs.
But then they're having arguments about, am I actually pressing on the organ? Then it's like, what nerve supply is actually going to the organ? Then they're talking about lymph and all this other stuff. I get to this point where I'm not prepared from a science-based perspective to explain what it is the clients are experiencing. And I have to say something really smart-ass. Like, a woman comes in, she's got low back pain, I do this, I help them, and she's like, how does it do that? And I'm like, nerves? Which seems like completely just like dismissive in a way. So I'm still trying to figure out, like, how do I give them, the students especially, how do I give them enough of an answer so that we can keep working on people and making it better, while at the same time not lying to them and just making up stories about why I think it works. Is that too much pressure, by the way? Okay. Do you want a little more on the side, or you want me to try to go into the other?
More on the side.
More, okay. So if I go down
It releases it. Like
or up.
There. Up. There.
So when you say it releases it, it feels like it's not hitting quite that spot.
Exactly.
Okay. So you prefer...
So when you go there, it actually feels like it's stretching and providing relief in there.
And here's the thing. What the pain science community seems to be saying, and I have... Oh, you have no idea how many conversations I have about this. All they talk about is stretching skin. Because they say that basically connects to the nerve, and then that's all the pressure you need. They don't like deep compression. How do I feel about deep compression?
You love deep compression.
So where's the fall off point? I'm deeply confused by it, because the clients keep asking for more pressure. My clients improve when I give them pressure.
Yeah.
Now, when I say pressure, I don't mean pounds per square inch. I mean, I keep asking, is it comfortable? Is it too much? You know, I have to do that again and again and again, because the amount of pressure you can receive and the amount of pressure you can receive can be wildly disparate. Now, if I shear just a little bit more towards the center.
Good.
Now, I'm also getting a very deep, like, abdominal aorta pulse here.
And they tell us to stay away from that.
Oh, okay.
Again.
So, in Thai massage, there's a series of things called blood stops. I stopped calling it that, and I started calling it an arterial tourniquet.
Okay.
Because if I say blood stop, people get freaked out. White people don't want their blood to stop. Like, I need that to move. If I call it a tourniquet has the benefit of being something that saves people's lives. So when the compressions are deep, this happens all the time. It doesn't even mean it's something I'm trying to do. It's almost like a secondary component of me applying pressure. Now, what happens when you blood stop organs?
That's not good.
Is it?
I would think. Oh, you flush them, right? Because when you release
Goes
them,
in
they
and
flush.
rinses back out.
In Chinasang, they're using certain, terms and, like, I want to say magical thinking, but I'm trying not to be derogatory for, like, what's going on. And the honest answer is I just don't know. I know that people seem to improve from a really wide range of conditions when I work on them. So, for instance, if I wanted to, I could literally run a Facebook ad in Austin and say, hey, if you're a woman with severe menstrual cramps, you should come on in and see me. I got this massage I do that's for your abdomen that helps. You see what I mean? That's real direct marketing. Women have no options. I talk to them. Because when women started opening up to me, because I'm a guy, right? And I don't have kids, so it's like I would do this stuff and they would start saying, I would sink into something and they're like, oh, that was where I had my appendix out. Oh, I had, what do they call that when you get that pain, that horrible,
Fibroid? No.
nah, fibroids, they'll talk about that.
Appendix,
Nah, there's something they get where it's like it gets inflamed.
Endometriosis.
Yeah, endometriosis. The women would open up to me about things in their sexual history or trauma or rape or, all this stuff. And it's like a lot of it had physical components. It wasn't just energetic. But they were just letting me know, oh, I'd had a C-section, I'd had scar tissue, they've had this, they've had that. But massage therapists aren't studying abdominal work and then applying it. And then if you go to somewhere like Massage Envy, can you even do abdominal work? No. Yeah. So it's kind of just a weird area. I'm continuing, I was poking at Kathleen, because I'm still asking questions trying to find out, why does it work or why does it seem to help? I keep using it because it seems effective. Fundamentally, I find the abdominal work very easy to administer, but everybody is very disparate in like what I find. I could literally work on someone and it's like their whole abdomen is completely open, and then it's like, what's this? And it's like you press on it and they're like, oh, I feel like my left shoulder. Like, why do I feel that in my left shoulder? And I'm like, I have no idea. I can say something smart ass like nerves, but I don't know enough to be able to say. And if I look at the pain science community, it's rough, it's brutal. How does it feel now?
Good. It feels like open.
Yeah.
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 Yep.
So how complex was that?
That was good. Want him to do the other side?
Yes.
Because I want to see what happens.
Okay.
On a few for the next couple days.
So a friend and colleague named Josh